I was devastated. I felt a lot of anger, sadness, and anxiety. I felt like my life was falling apart. I was too that I would never, and it never occurred to me that I would actually acquire the virus.
For today's episode, we are going to talk about one of the global issues that the world is facing right now. Today, join with me as I unlock and witness the journey of a 24-year-old call center agent living with HIV. Only here at Gene's Note. According to the latest fact sheet of UNAIDS in the year 2020, an estimate of 37.6 million people globally was living with HIV. HIV.org said that approximately 84% of people with HIV globally knew their HIV status, while the remaining 16%, or about 6.0 million people, still need access to HIV testing. In the Philippines, DOH or Department of Health reported that there are 890 total reported cases last January 2021, and the report shows that there is an average of 29 cases per day. These 890 cases comprised 1% of the 83,755 total diagnosed cases since January 1984.
I was 20 years old when I was diagnosed. I was devastated, of course. I feel like my life was falling apart.
Okay. What do you know about the virus before the diagnosis?
Well, I know that it's untreatable. You're gonna, but I know that it can be treated and controlled. HIV means living in caution. True, but through medical advancement, PL-HIV or people living with HIV can now live health.
According to peacecorp.org, HIV or the Human Immunodeficiency Virus is the virus that can lead to AIDS or acquired immune deficiency syndrome. Once a person is HIV positive or infected with HIV, he or she is permanently infected. DOH stated that HIV is a viral infection that can attack and slowly destroys the immune system of the infected person that leads to immunodeficiency. Do you know how you got infected? Can you share or tell your story if it's okay?
I, okay, yeah, it's okay, it's fine. Yes, I was sexually active before OM reduction. I also had multiple sexual partners, so I guess that's the main reason why. So, one misconception about people living with HIV is that they can no longer live a longer life. So, some people transmit it through saliva and sweat or any form of physical contact, when in fact it can only be transmitted through sexual intercourse, needles, blood transfusion.
HIV.gov explains that HIV can only be spread through specific activities. You can only get HIV by coming into direct contact with certain body fluids from a person with HIV who has detectable viral load. These fluids are blood, semen and preseminal fluid, rectal fluids, vaginal fluids, and breast milk. For the transmission to occur, the HIV in these fluids must get into the bloodstream of an HIV-negative person through a mucous membrane that is found in the rectum, vagina, mouth, or tip of the penis, open cuts or sores, or by direct injection. It means that the main transmission of HIV is unprotected sex and sharing infected blood products or sharing needles and syringes, and can be transmitted through mother to the baby. Do you feel any symptoms or signs or something?
No, part of it means knowing the responsibility regarding getting tested regularly. I found it early, so I haven't experienced any symptoms.
Just like other viruses and diseases, a person living with HIV can feel and suffer from these common symptoms.
So what are the signs and symptoms of HIV infection? So most people will present with very severe flu, so temperature, muscle pains and aches. They won't be able to get off the couch, they won't be able to go to work. Other people will present with a diarrheal illness or think they've got a gastroenteritis, so very severe diarrhea or maybe vomiting. Other people will present with swollen lymph glands in their neck or under their armpit or in their groin, or other people will present with a rash.
What does the doctor recommend right after you get diagnosed, or what treatment you are doing or medications you are taking right now?
I am a retroviral therapy, which controls the spread and suppresses the amount of viral load in the blood.
If you have HIV, it is important to start treatment with HIV medication, or called antiretroviral therapy or ART or ART, as soon as possible after your diagnosis. HIV medication can reduce the amount of HIV in your blood and also called the viral load to a very low level. According to the Department of Health, HIV can be prevented by abstinence, be mutually faithful, by checking your status, don't get drugs, and educate yourself and others. Has your status affected your view of your future at all?
Yes, when I was things about how society will treat me and about how I can never have a normal dating life and I will have difficult relationships and also fitting in again to the society.
Just like Valerio, people with HIV and AIDS are nothing to be afraid of. They are people just like every single one of us, and each has a story to tell. These people should be helped, embraced, and not dismissed. For the last question, and to end this interview natin, what message do you want to say to other people?
I wanted to say that this is not the end of the line. We should remain hopeful and aspire to bring back what was taken from us, that we're obstacles and future adversities that comes with the disease or virus.
I am Janelle Cazar, 220 from BC Bio, and this is Gene's Note.